Dear students, the difference between good day and bad day is based on your attitude. So, your attitude determines your destiny. If you feel anything is difficult, do it, don't quit. I'm Chitra Silvania welcoming you all to this online class. In first unit, we have 3 chapters in which we have completed 2 chapters in the previous classes. Let's have a fast recap on these chapters. In chapter 1, reproduction in organisms, the topics we covered are modes of reproduction, asexual and sexual reproduction. In second chapter, human reproduction, we discussed human reproductive systems, gametogenesis, menstrual cycle, menstrual disorders and menstrual hygiene, fertilization and implantation, maintenance of pregnancy and embryonic development, and finally, parturition and lactation. Students, I hope you all have a clear understanding on these chapters. It's a duty to read. You should not quit. So do it. Don't quit. Then only you can reach your success. In today's class, we are going to understand the importance of sex education and reproductive health, evaluates the effects of maternal and infant mortality, learns the importance of amniocentesis as a prenatal diagnosis, identifies, compares, and explains different types of contraceptive devices, and we will discuss the medical necessity and social consequences of MTP, that is, medical termination of pregnancy, STD, that is sexual transmitted diseases, infertility, and ART, associated reproductive technologies. In our third chapter, reproduction health. First, we see what is reproductive health. Reproductive health represents a society with people having physical and functionally normal reproductive organs. Healthy people have healthier babies and are able to care for their families and contribute more to the society and community. Hence, health is a community issue. Reproductive system is a complex system controlled by the neuroendocrine system. Hence, it is important to take necessary steps to protect it from infectious diseases and injury. So first we see what is the need for reproductive health. India is one of the most important countries in the world to initiate the family planning program since 1951 and is periodically assessed every decade. These programs are popularly named as RCH, that is Reproductive and Child Health Care. There are various tasks carried out by this RCH. The important tasks are creating awareness and providing medical assistance to build a healthy society, introducing the sex education in schools to provide information about adolescents and adolescent-related changes, educating the couples and those in the marriageable age groups about the available birth control methods and family planning norms, creating awareness about care for pregnant women and the importance of breastfeeding, and to identify new methods or to improve upon the existing methods of birth control. Healthcare programs are such as massive child immunization, supply of nutritional food to the pregnant women, Janani Suraksha Yojana, Janani Sishu Suraksha Karyakram, RMNCH, and A approach. That means an integrated approach for reproductive, maternal, newborn, child, and adolescent health. And then Pradhan Mantri Surakshit Matravit Abhinayan, etc. These are all taken up by the national level by the government of India. Next, we see what is Amniocentesis. Amniocentesis is a prenatal technique used to detect any chromosomal abnormalities in the fetus, and it is being often misused to determine the sex of the fetus. Once the sex of the fetus is known, there may be a chance of female feticide. Hence, this amniocentesis is banned. So, what is sex ratio? Sex ratio is the ratio of males to the females in a population. In India, the child sex ratio has decreased over the decade from 927 to 919 female for every 1,000 males. Female feticide and infanticide is the manifestation of gender discrimination in our society. So, what is female feticide? Female feticide is aborting the female in the mother's womb. So, what is female infanticide? Killing the female child after her birth. கள்ளிப்பால் குத்து சாவடிக்கிறது அந்த போல. So, in UNDPS GH 2018, that is United Nations Developmental Program Gender Inequality Index, reflected that India was ranked at 135 out of 187 countries due to the availability of very few economic opportunities to women as compared to men. So, what are the various steps taken by the government of India to protect this or to prevent this female feticide and infanticide? First, the act is the PCP NDT Act. I repeat, PCP NDT Act. Preconception and Prenatal Diagnostic Technique Act in the year 1994. This enacted to ban the identification of sex and to prevent the use of prenatal diagnostic techniques for selective abortion. Next one is the POCSO Act. That means prevention of child from sexual offences. And then sexual harassment at workplace, Prevention, Prohibition and Readdressal Act, and the changes in the criminal laws based on the recommendations of Justice Verma Committee in 2013. These are all aims at creating a safe and secure environment for both females and males. Next, we move on to population explosion. What is population explosion? Increased health facilities and better living conditions have enhanced longevity. According to a recent report from the UN, India's population has already reached 1.26 billion and is expected to become the largest country in population size into around 2022. To overcome the problems of population explosion, birth control is the only available solution. People should be motivated to have smaller families by using various contraceptive devices. And government also are making so many advertisements in the medias as well as the posters, bills, etc. with a slogan, Nam iruvar namak iruvar, we two ours two. Lari pinadile, auto pinadile எழுதியிருக்கோம். And Nam iruvar namak oruvar. So now we can say we two ours one. We have also motivated to control the population growth in Tamil Nadu. So next we see about the various birth control methods. What is birth control method? The voluntary use of contraceptive procedures to prevent fertilization or prevent implantation of fertilized egg into the uterus is termed as birth control. There are two types of contraceptive methods. They are temporary and permanent birth control. And we will see the contraceptive methods in detail. Contraceptive methods. These contraceptive methods are the only way to overcome the problems of population explosion. An ideal contraceptive should be user-friendly, easily available, with least side effects, and should not interfere with sexual drive. These contraceptive methods are of different types: natural method, barrier method, hormonal method, surgical method, intrauterine devices, oral injectable implant, and it should not also no way interfere with the sexual drive. First, we see the natural method, coitus interruptus. What is coitus interruptus? It is the oldest family planning method. The female partner withdraws his penis before ejaculation, thereby preventing the deposition of semen into the vagina. The advantage of this method, it does not require the use of any drug, does not interfere with normal body functions. Second one is the periodic subsistence. Periodic subsistence, it is also called rhythmic method. Ovulation occurs at about 14th day of the menstrual cycle. Ovum survives for about 2 days and sperm remains alive for about 72 hours in the female reproductive tract. Coitus, that is intercourse, is to be avoided during this time. Couples should avoid the intercourse from the day 10 to 17 of the menstrual cycle when ovulation could be expected. Next is the lactational amenorrhea. Menstrual cycle reassume as early as 6 to 8 weeks from parturition, that is childbirth. However, reappearance of the normal ovarian cycles may be delayed for 6 months during breastfeeding. This delay in ovarian cycle is called lactational amenorrhea. Absence of menstruation due to intense lactation. It serves as a natural but an unreliable form of birth control. And next we move on to the barrier methods. So what is a barrier method? In these methods, the ovum and sperm are prevented from meeting so that fertilization does not occur. There are two types of barrier method, chemical barrier and mechanical barrier. First, we see the mechanical barrier. Condoms. Male condoms usually made up of lacteus that covers the erect penis during penetration of vagina, and the female condoms is made up of polyurethane loose sheath with 2 rings on either side, can be inserted about 8 hours prior to sexual intercourse and can be kept in for about 12 hours after intercourse. It can be used more than once during this period. Next is the diaphragm and the vaginal cup. We can use this cup with a metal coil in its rim which is fitted across the mouth of the uterus, that is the cervix. It is used to cover the vagina and cervix before coitus so as to prevent the entry of ejaculated semen into the female reproductive tract. These condoms protect against pregnancy as well as sexually transmitted diseases like AIDS. This can prevent conception, and these condoms are also made up of polyurethane, lacteus and lambskin. And these some of the chemical barriers are foaming tablets, melting suppositories, jellies, creams are to be used as a chemical agent that inactivate the sperms in the vagina. And these are some of the chemical and the mechanical barrier methods to prevent conception. Next is the hormonal method. Hormonal barrier. It prevents the ovaries from releasing the ova and thickens the cervical fluid, which keeps the sperm away from ovum. The oral contraceptives. Pills are used to prevent ovulation by inhibiting the secretion of follicle stimulating hormone and luteinizing hormone. A combined pill is the most commonly used birth control pill. It contains both progesterone as well as estrogen hormone, and these are based on the hormones result to prevent ovulation. So, Sahali, it is a non-hormonal, non-steroidal contraceptive method which is produced by the Central Drug Research Institute in Lucknow. India contains a non-steroidal preparation called centrochromen, which is popularly called as Sahali. And this slows down the growth of rate of endometrium as well as to speed up the movement of the embryo so that implantation cannot occur. It can be taken once in a week or 2 pills per week up to the first 12 weeks of ovulation. This hormonal method is less advisable as it creates so many problems to the uterus. Since these pills helps in destroying the uterus. Next is the intrauterine devices. These intrauterine devices are inserted by the medical experts in the uterus through the vagina. These devices are available as copper releasing IUDs, hormone releasing IUDs, and non medicated IUDs. First is the non medicated IUDs. It is a type of intrauterine contraceptive device made of inert plastic in a double S-shaped structure which is inserted for long periods. Example for this is the lips loop. And second one is the copper releasing IUDs. This copper releasing IUDs increases phagocytosis of sperms. That means it destroys the sperms within the uterus, and copper ions released suppresses the sperm motility and the fertilizing capacity of the sperms. The side effects include heavy menstrual periods, painful periods, or the device may come out. Example for these copper releasing IUDs are CUT, CU7, multiload 375, etc. They can remain in the uterus for 5 to 10 years. It releases free copper and copper salts into the uterus and suppresses the sperm motility. Next is the hormone releasing IUDs such as progesterone hormone. It makes the mucus on cervix become thicker, and this mucus blocks the entry of sperm in uterus. Next we move on to the surgical method or the sterilization. It is used by the male and female partner as a terminal method to prevent any more pregnancy. It is a permanent contraceptive method advised for both male and female. First, we move on to the tubicotomy. The first modern female sterilization procedure was performed in 1880 by Dr. Samuel Lurgan of Toledo in the United States of America. In India, it is started in first 5-year plan in 1951 as family planning. What is tubicotomy? A small part of fallopian tube is removed or tied up through a small incision into the abdomen or through the vagina. This prevents fertilization as well as entry of the egg into the uterus. Next is the vasicotomy. First vasicotomy was performed on dog by copper in 1823. In India, it is launched in 1954 under family planning program and applied at huge scale in 1976. What is vasicotomy? A small part of vas deferens is removed or tied up through a small incision on the scrotum. This prevents the entry of sperm into the urethra. Next we move on to MTP and STD. Medical termination of pregnancy. Medical method of abortion is a voluntary or intentional termination of pregnancy in a non-surgical way. Early medical termination is extremely safe up to 12 weeks, that is the first trimester of pregnancy. Abortion during the second trimester is more risky as the fetus becomes intimately associated with the maternal tissues. Government of India legalized MTP in 1971 for medical necessity and social consequences with certain restrictions like sex determination and illegal female feticides to avoid its misuse. MTP performed illegally by unqualified quacks is unsafe and could be fatal. MTP of the first conception may have some serious psychological consequences. So, MTP should be properly handled. What is STD? Sexually transmitted diseases. It is also called venereal diseases or reproductive tract infection, or called as sexually transmitted infection STI. Normally, this STI are transmitted from one person to other person during intimate sexual contact with an infected partner. Infections like HIV, hepatitis B are transmitted sexually as well as by sharing of infusion needles, that is the Veflon. We can call it as Veflon, surgical instruments, etc., with infected people, blood transfusion or from infected mother to baby. People in the age of 15 to 24 are prone to this infection. There are different types of STI: bacterial, viral, protozoan, and the fungal STI. Let's see one by one its causative agent and the symptoms. First is the bacterial STI. Gonorrhea is caused by Neisseria gonorrhoeae, which affects the urethra, rectum, and throat, and in females, the cervix also get affected. Pain and pus discharge in the genital tract and burning sensation during urination occurs. Second is the syphilis. It is also a bacterial STI which is caused by Treponema palladium. The symptoms takes place in 3 stages. In primary stage, formation of painless ulcers found on the external genitalia. In secondary stage, skin lesions, rashes, swollen joints, and fever and hair loss may occur. And in tertiary stage, loss of movement, mental disorder, visual impairment, heart problems, etc. takes place. Next one is the chlamydiasis. It is caused by Chlamydia trichomatis. This trachoma affects the cells of the columnar epithelium in the urinogenital tract, respiratory tract, and conjunctiva that is present in the eye. Next one is the lymphogranuloma veruneum. It is caused by Chlamydia trachomatis. It affects the cutaneous, that means the skin, or mucosal genital damage, urethritis, and endocervictis inside the cervix. Locally harmful ulcerations and genital elephantiasis are the symptoms of this lymphogranuloma veruneum. Next, we can see some of the viral STIs. First is the genital herpes, caused by herpes simplex virus, which causes pain during urination, bleeding between periods, swelling in the groin nodes. Next, second one is the genital warts, which is caused by human papilloma virus. It forms tumors on the external genitalia, cervix, and perianal regions. Hepatitis B is another viral STI which is caused by hepatitis B virus, which causes fatigue, jaundice, fever, rash, and stomach pain. Liver cirrhosis and liver failure occur in the latter stage. Next one is the AIDS, which is caused by HIV, human immunodeficiency virus. The symptoms of AIDS are enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction, and night sweating. We see the fungal STI, that is candidiasis, which is caused by Candida albicans. It attacks the mouth, throat, intestinal tract, and vagina. Vaginal itching, abnormal vaginal discharge, and pain during urination. This fungal STI mainly occurs in female. Next one is the protozoan STI, that is trichomoniasis, which is caused by Trichomonas vaginalis. The symptoms are vaginitis, greenish yellow vaginal discharge, itching and burning sensation, urethritis, epididymitis, and prostatitis. It may also occur both in male and female. So, how we can prevent these sexually transmitted diseases? Avoid sex with unknown partner or multiple partners. So, we should use condoms during sex, and in case of doubt, we have to consult a doctor for diagnosis and get complete treatment. Next, we move on to cervical cancer. Cervical cancer is caused by a sexually transmitted virus called human papilloma virus. This human papilloma virus may cause abnormal growth of cervical cells. The most common symptoms of cervical cancer are pelvic pain, increased vaginal discharge, and abnormal vaginal bleeding. The risk factors of cervical cancer include having multiple sexual partners and prolonged use of contraceptive pills. How you can diagnose the cervical cancer? We can diagnose the cervical cancer by pap smear combined with an HPV test. X-ray, CT scan, MRI and PET scan may also be used to determine the stages of cancer. The treatment of cervical cancer include radiation therapy, surgery and chemotherapy. Cervical cancer can be prevented with vaccination. Primary prevention begins with HPV vaccination of girls aged 9 to 13 years before they become sexually active. Healthy diet, avoid using tobacco, preventing early marriages, practicing monogamy, and regular exercise minimize the risk of cervical cancer. Students, we have gone through some important topics which is very useful for your NEET exams also. So please go through and study the lesson. If you have any doubt, feel free to ask me. This first unit is very important for your public exams also. I have sent some questions in the assignment. Study and write it in your notebook. Thank you.